Today's program is a very interesting program because we've had as I always say to you, this program really is yours, and we try to answer questions that come our way. And you say, well, why during this period of time when we've been so challenged by this insidious virus, are we talking about something called diabetes? Welcome, Dr. Morrow.
Thank you so much. It is such an honor to be with you. Thank you for inviting me.
Well, we're glad to have you. Dr. Morrow, what is this Interprofessional Diabetes Education and Awareness known as IDEA initiative? What is it all about?
So the IDEA initiative started with a conversation I was having with the executive director of the American Diabetes Association. And she was talking about what a challenge it was for individuals that were being diagnosed, hundreds daily being diagnosed with diabetes. And there just weren't the community resources available to help educate them. And doctors just didn't have the time to sit with patients and educate them on how to manage their diabetes, for those with pre-diabetes, how to prevent diabetes. And I thought to myself, we have the Health Professions Division at Southeastern University, which I know you were the founder of, and we have so many talented faculty and students that are passionate about learning and passionate about making a difference in the community. And I thought, maybe we could make a difference here. And we began building relationships with community partners to go out into the community and do diabetes prevention and management workshops. And they build a diabetes prevention and management workshop from the different lenses of their different professions. And then they go out into the community and do those presentations. So we have a community collaborations director, Marsha Lewis, who works with all of those community partners. And you'll see on the screen a list of all the community partners that we work with. And we've been doing that since 2012 through 2020. And what's interesting, last year, a pandemic hit, as we all know, right? And in June, I was sitting there thinking, gosh, what are we going to do? Are we going to be able to go out? We can't go out into the community to do these presentations. We can't go to the community sites. So are we going to just skip it this year and pass, and we'll come back when things get a little better? Or do we try something innovative? We've also created videos that we can use, PSA style videos, public service announcement style videos.
Well, I think maybe would be a good time for us to look at some of those videos that were created for NSU IDEA, the student team. So why don't we begin with the basics?
Diabetes. When people hear this word, the first thing they tend to think is, oh, that doesn't apply to me. However, this is not necessarily true. In 2018, 34.2 million Americans, or 10.5% of the population, had diabetes, and 84.1 million adults had pre-diabetes. The CDC reported that 1.5 million Americans are newly diagnosed with diabetes each year, and 7.3 million people are undiagnosed. In the U.S., African Americans and people of Hispanic origin have a higher prevalence of diabetes compared to non-Hispanic whites. Specifically, the risk of diabetes is 77% higher among African Americans than non-Hispanic whites. And among Hispanics, the death rate from diabetes is 50% higher than for non-Hispanic whites. Of note, those with diabetes are significantly more likely to suffer health complications such as blindness, kidney disease, and amputations. But before we get ahead of ourselves, let's start at the beginning. What causes diabetes? Well, let me break it down for you. Your body's cells need sugar to function properly. However, sugar can only get into cells with the help of a hormone called insulin. When there's a problem with insulin or your body's response to insulin, the sugar cannot enter the cells, and instead it builds up in the blood where it doesn't belong. That is how diabetes happens. There are 3 types of diabetes: type 1, type 2, and gestational. Type 1 is when the body makes little to no insulin. Without the help of insulin, sugar cannot enter the cell, and so it builds up in the blood. Type 2 is when the body stops responding to insulin. So their insulin is there and ready to help move the sugar from the blood into the cells, but the body does not recognize it. Now, the exact cause of type 1 diabetes is unknown, but scientists believe the illness to be autoimmune in nature. One's ethnicity can also play a part in the chance of having type 1 diabetes. Particularly, Caucasians are more likely to be living with type 1 diabetes than African American and Hispanics. In contrast to type 1, American Indians, African Americans, Pacific Islanders, Asian Americans, and Hispanics make up a larger part of the population of those living with type 2 diabetes. Though there are genetic predispositions with type 2 diabetes, lifestyle is thought to be a key risk factor. Physical inactivity and excessive body fat have been linked to type 2 diabetes. General symptoms include intense thirst, urinating often, and blurred vision. However, those with type 2 diabetes may not present with any symptoms at all, and it may actually be diagnosed during routine lab tests. Some potential complications of diabetes are diabetic retinopathy, cataracts, trouble during dental procedures, and kidney and heart problems. About 40% of people with diabetes will develop some form of diabetic retinopathy. Diabetes has also been shown to speed up the development of cataracts of the eye. During invasive dental treatments, the high level of glucose in patients with uncontrolled diabetes can allow bacteria in the mouth to damage surrounding gums. Damage to the gums opens a door for infection to be spread to other parts of the body. Patients with uncontrolled diabetes also experience poor wound healing. A low-risk procedure could turn into a serious infection, needing immediate attention and medication. In individuals with diabetes, there is also a higher incidence of periodontal disease. Diabetes and uncontrolled glucose in the blood can affect almost every organ and organ system in the body. Some major complications include impaired kidney function and heart disease. The goal of treating diabetes is to control blood sugar levels and keep them within normal range. Since insulin is not being produced in type 1 diabetes, this condition is usually managed with insulin. Type 2 diabetes is a little different since it is managed with non-insulin medications such as metformin. However, if it's not controlled with these medications, one may also need to take insulin. Aside from medications, there are steps you can take to manage type 1 and type 2 diabetes. Many studies show that maintaining a healthy lifestyle is a way to prevent and manage diabetes by minimizing risk factors such as high blood pressure and blood cholesterol. Maintaining a proper diet and nutrition is important. This means eating a variety of foods from different food groups, and then avoiding processed foods, carbohydrates, and simple sugars, like sodas, candy, and white flour. Proper diet also comes with portion control. Exercising on a regular basis will help your body function properly and will help prevent and manage diabetes. Exercise not only helps reduce weight, but also acts a little bit like an extra dose of insulin, which manages and improves your blood glucose levels. Another important step is taking care of your mental health. Stress can cause blood glucose levels to rise, so it is important to find ways to reduce and avoid stress by taking care of yourself. So overall, healthy prevention and management of diabetes includes taking care of all essential parts of your body. And importantly, don't hesitate to ask questions and reach out to any health professionals with concerns, as they are all there to help you.
That was very, very interesting and very informative. But can you explain the difference between type 1 and type 2 diabetes? Why don't we just show, again, we have a video that relates to that particular subject area, so we can play that right now.
This is some great cake. Cassandra, come over here and try some.
Michael, aren't you type 1 diabetic?
Yeah, but let's take a moment and actually discuss what that means.
Type 1 diabetes is a disease where your pancreas produces little to no insulin. Whereas type 2 diabetes is a disease that affects the way the body processes glucose. So with focusing on type 1 diabetes, you have to be very careful with what you eat. This includes portion control, monitoring glucose levels, taking insulin, and making sure you are not eating too many sweets.
So for this specific example, we are using slices of cake to demonstrate that type 1s can still have sweets, but have a smaller amount versus a larger amount, as our pancreases handle glucose differently.
Exactly. It's very important for diabetics to take the appropriate amount of insulin needed for meals, count their carbs, and be aware of portion control, so they don't go into hyperglycemia or DKA, which can be life-threatening.
Hi, I'm Madison Lessard, and I'm a student of optometry at NSU, and I'm here to bust some myths about type 2 diabetics.
Let's see what this one says. As long as food doesn't have sugar in it, it's okay to eat.
Eating foods high in sugar is practically unavoidable, since fruits and vegetables are actually carbohydrates that get converted into glucose in our bodies. We need the glucose to actually function. Diabetics can consume high sugar meals such as desserts as long as it is controlled in a moderate size and the portion is smaller.
Consuming too much sugar is the main thing that leads to type 2 diabetes.
Actually, common risk factors include how much physical activity you get, your ethnicity, your age, and your weight.
So what are the facts?
Fact: carbohydrate counting is a sustainable way to manage diabetes.
Like most people, sticking to a well-balanced, healthy meal plan is a positive way to manage diabetes. Eating more leafy greens, swapping white bread for whole grains, limiting added sugars and processed foods are general ways to go. However, some people need more customized meal plans.
So at the end of the day, remember, portion, plan, and don't sugarcoat it.
People just don't relate to hypertension and its relationship to diabetes, but there is a tremendous impact on the health. And we have a video that we're going to show right now, and then I'm going to ask you for some comments. So let's play that video.
Welcome to the hypertension highway. Unfortunately, there seems to be a lot of traffic. Let's get off at the physician's office to escape it.
Having your blood pressure checked is important for understanding your health status. Blood pressure is the force of the blood that is pushing against the vessels throughout the body, written as two numbers. The top number, called systolic pressure, is the pressure on the vessels when the heart pumps blood into the body during each heartbeat. The bottom number, called diastolic pressure, is the pressure on the vessels in between each heartbeat. When the pressure on the vessels increases above the normal limit of 120/80, it is considered elevated blood pressure. And at 130/80 and above, it is considered hypertension. This can cause many problems such as heart attack, stroke, or kidney failure. These problems occur unexpectedly since hypertension doesn't have any symptoms, which is why it's called the silent killer. Currently, about 30% of the United States population has hypertension. Family history, obesity, and smoking are some factors that put you at risk of developing hypertension.
Good thing we stopped at the primary care doctor. Now we're back on the highway, but there still seems to be traffic. Let's stop at the eye clinic.
Hypertension affects the whole body, so it's no surprise that it affects the eyes. Your eyes are the only place in your body where blood vessels can be viewed directly. This means your eye doctor can see early effects of high blood pressure before other signs arise. By looking in your eye, your doctor can see the structures of the retina, which is the thin layer of nerve tissue that lines the back of your eye and senses light. This is what your doctor sees as they perform a dilated eye exam. Here you can see the optic nerve, which connects your eye to your brain and retinal arteries and veins of a healthy individual. Uncontrolled hypertension damages all of these structures. Additionally, hypertension is the most common cause of vessel occlusions in the eyes, which is when a blood clot clogs a vessel. When the blood can't drain properly, bleeding occurs, and these events can lead to painless vision loss that rarely returns to normal. Hypertension is a silent killer because there are no early warning signs. Therefore, a thorough dilated eye exam is critical to early detection and treatment that can prevent and reduce visual impairment.
It was great to learn how hypertension can affect the eye, but my tooth is starting to hurt. Let's stop at the dentist office.
Hey there, Mr. Johnson. How are you doing today?
How you doing, Doc? Good to see you.
Good to have you. Before we get started with your root canal treatment, I'm going to go ahead and update your medical history and take your vitals. So I'm going to go ahead and take your blood pressure right now.
Okay.
Warm your arm. Make sure your legs are uncrossed. Very good. Okay, Mr. Johnson, are you still taking your hypertension medication?
Oh, I forgot to this morning. It's not a big deal, right?
Well, your blood pressure right now is 159/95, so I'm afraid we won't be able to do your treatment today.
Why not, Doc? It's not a big deal, right?
Well, actually it is. When we go ahead and start drilling in your teeth and creating the access to get to your pulp inside your tooth, we want to make sure that your blood pressure doesn't cause too much bleeding, because the medications help control your blood pressure so that your vessels don't get too tight and cause excess bleeding when we open up the tooth. So it's very important that we keep that under control before the procedure.
Okay, so we'll reschedule and take it another time?
Yeah, that sounds good.
All right, thank you, Doc.
The other thing.
I had no idea that hypertension can affect dental procedures as well. All this sitting down has made my legs numb. Why don't we go for a walk?
Exercise is actually the cheapest and most accessible way for you to take control of your health and manage your high blood pressure. Research has shown that moderate intensity physical activity most days of the week will lower your blood pressure and improve your overall fitness. So what is moderate intensity physical activity? Well, it's as simple as walking, as I'm doing right now, 30 minutes a day, 5 days a week. You could also do some low-impact aerobic exercises. You can do that in the comfort of your home or out at a park. I'm not talking about training like LeBron in the gym. These are things like dancing, swimming, riding a bicycle, playing golf. As long as you are doing the recommended dosage, you're making an impact. And what is that dosage? 150 minutes per week. That is the amount of physical activity that is recommended for you to make a positive impact on your health. And how you split up that 150 minutes is completely up to you. Bottom line, the more you work towards improving the amount of physical activity that you do per week, the more efficient your heart is going to work. And that means the more that you took control of your blood pressure. That means less time spent at the doctor. That means less time spent in the line at the pharmacy. And that means less money spent on copays and on prescription refills. It starts with you, and you have what it takes to take control of your blood pressure.
All the exercise has made me hungry. I wonder what we can eat that will also help control hypertension.
The dietary approaches to stop hypertension, or DASH diet, is recommended for the prevention and control of hypertension. It emphasizes vegetables, fruits, low-fat dairy foods, whole grains, fish, poultry, and nuts. It is recommended to keep your sodium intake below 2,300 milligrams per day compared to the normal max daily intake of 3,400 milligrams. Foods high in sodium include cold cuts, smoke, cured salted or canned meat, frozen dinners, canned entrees, and salted nuts. It is also recommended to consume foods rich in magnesium, potassium, and calcium because they help to lower blood pressure.
At our last stop, we will discuss how pharmacists can assist patients with their medication needs. We will take a closer look at the importance of adhering to blood pressure medications and how your pharmacist can assist with managing your medications.
Having a higher than normal blood pressure can be due to medication non-adherence. It's important to take blood pressure medications as prescribed by your doctor and never discontinue a medication without consulting your doctor first. By taking your medications regularly, you should expect to see an improvement in your blood pressure. But remember, it will only remain controlled if you continue your medication. It's recommended to measure your blood pressure daily and record it in a journal to share with your doctor during visits. This will help determine if the medication has been working for you. Remember that most people with high blood pressure do not have any symptoms. And if not controlled early on, it can lead to serious events such as heart attack, stroke, and damage to other organs. The pharmacist can also assist in improving your adherence by addressing any concerns you may have. A helpful way to remember to take your medications is by using an alarm clock or pill organizer. If the cost of a medication is too high, the pharmacist can provide you with more affordable options. If experiencing any side effects, tell your pharmacist or doctor and they can help adjust the medication as needed. Lastly, always talk to your pharmacist about any over-the-counter medications or supplements you may be using, as this may increase your blood pressure. By leading a healthy lifestyle and adhering to medications, you can continue to see improvements in your blood pressure and overall health.
We learned a lot about hypertension. We went over how blood pressure is measured and what the target blood pressure is. Hypertension can also affect the eye, so it is important to check in with an optometrist. There are also many medications available to help control blood pressure, and it is important to adhere to it. Additionally, exercise and a DASH diet can also help decrease blood pressure. And look, the traffic has cleared on the hypertension highway. Time to go home.
Now we're going to be talking about telehealth and telemedicine. How can it be used to manage diabetes?
Hi Anna, my name is Dr. Gupta. I understand you're here for follow-up regarding lab work. How are you doing today?
I'm okay.
I've just been very thirsty and tired lately.
I know we've been working a lot on exercise and nutrition, but these results confirm your diagnosis of type 2 diabetes. I understand this is not what we hoped for, but I will help you manage your condition alongside a strong, knowledgeable team of healthcare providers.
I was just formally diagnosed and was wondering how occupational therapy could help me.
No problem. Well, we can work together to address those concerns and any others that you might have. We can also make sure that we take the steps that are necessary to prevent the progression of the disease and find alternative ways to do things that you love to do.
We'll go over how to take your medication, what kind of side effects you can expect, and answer any questions you may have. Remember, you should continue to take your medication as prescribed by your doctor, even if you're feeling better. I want to be sure that you understand how important it is to be adherent to your medication and can help you set reminders to take it.
The best advice that we can give is to maintain a good oral hygiene.
Diabetic patients may present vision changes that include a decrease in vision, floaters, and poor color vision. Performing yearly dilated eye exams are crucial to the prevention and management of diabetic retinopathy. Diabetic retinopathy is seen in 40 to 45% of Americans diagnosed with diabetes. It is the leading cause of new cases of blindness in adults. Complications of diabetes can be decreased by controlling blood glucose levels, blood pressure, and receiving preventive care in a timely manner.
Overall, it is important to lead a healthy lifestyle to prevent conditions such as diabetes. Some examples that may help include exercising and eating healthy. In relation to exercise, there are many different options to choose from. You go for a walk, ride your bike, go swimming, and do other types of moderate exercises 5 days a week. Additionally, it is important to have nutrient-dense meals containing fruits and vegetables. One of the most important things to remember is that you're not alone. Surrounding yourself with people who support you will only help your eating and exercising habits. All in all, we hope that from this video we can provide ways to help manage diabetes as well as educate others with prevention and management tips. Remember to always consult your healthcare provider before making any medical decisions.
So the last video is about exercising and eating the right foods for exercising with diabetes.
Hi everyone, we're part of an interdisciplinary team and today we will be briefly discussing exercise and diabetes. First, we're going to be explaining SMART goals. We know motivation to engage in activity can be difficult. Research has found that a certain type of goal, known as a SMART goal, is the most successful in changing someone's behavior. Following these guidelines helps create realistic goals that are more likely to help you change your behavior.
Now I'm just going to give you an example of what SMART goal is. So you want something that's specific, and it's a goal that you'll be able to do at least once per day, which could be a stretch, and this will help you prevent and manage your diabetes. It's measurable because you're able to measure your progress by how easy these stretches become after each week, and it's achievable because these stretches are super easy and quick and don't usually require a lot of time from your busy schedule. They're realistic because it's important to help you improve your overall health, and it's timely and tangible because you're able to choose a time that works not only with your schedule, but you're able to encourage others to help you, and this increases motivation in everyone. So overall, SMART goals can help you improve your health, and Shane will explain the importance of stretching and show you how to do some.
Today I'm going to be demonstrating some simple exercises and stretches that you could do virtually anywhere. And that's important to know in these times of COVID, is that you don't need a lot of equipment, you don't need a gym membership, and all you need to know is exercise is free. It can be done in any open space, and the important part is you get up and move, and that is how you maintain and even prevent diabetes. So let's get started.
This first stretch is called an adductor or growing stretch for your hips. It's good to increase circulation and to also prevent injury. You want to hold each stretch for ideally 60 seconds, but you can break it up as 3 sets of 20 seconds. Make sure you do both legs. The second stretch is for your hamstrings. It's safer if you do it seated, but you could also do this standing. Scoot to the edge of the chair until you feel a light stretch in the back of your leg. Be careful not to slouch forward like in the picture. And always remember to do both sides, 3 times 20 seconds each. This first exercise for strengthening is called calf raises or heel raises. It helps bring circulation back up to the legs, which is important for diabetes. You could do this 3 sets of 15 either in the chair or to make it advanced, you could do it standing behind the chair, slow and controlled. This next exercise is called sit to stand. It strengthens the lower body and the core muscles. Slow and controlled, bring your nose past your toes and repeat standing up, either with support of your hands or to make it challenging, you can cross your arms. The key is slow and controlled.
If you have diabetes, it is important to monitor your blood glucose or sugar and insulin when exercising. Monitoring the levels of your insulin and sugar while exercising can prevent problems such as feeling tired during your workout. Be careful if your blood sugar dips below 70 milligrams per deciliter, because this can lead to a condition called hypoglycemia. Hypoglycemia can lead to hunger, nausea, sleepiness, weakness, and headaches, among many other things. If you're taking insulin before you exercise, place your shot in a part of your body that you're not going to be exercising to avoid hypoglycemia. For example, place the shot in your arm if you're going for a run. Checking your sugar level before you start exercising can let you know how much you should eat beforehand. If your sugar level is over 300 milligrams per deciliter, talk to your doctor to see if it is safe for you to exercise. Sugar that is between 150 to 300 milligrams per deciliter is a good range to be in before starting a workout. At this level, it is important to eat around 15 to 30 grams of carbs. Examples of foods with 15 grams of carbs are 1 slice of bread, 1 small fruit, or 2/3 cup of plain yogurt. 30 grams of carbs looks like half a peanut butter sandwich and 1 cup of low-fat milk. If your sugar is below 150 milligrams per deciliter at the start of your workout, eat something with protein. Examples of food with protein are 15 almonds, 1 tablespoon of peanut butter, 1 egg, or 1 piece of string cheese. During exercise, if you're feeling lightheaded, check your blood sugar. If it is below 70 milligrams per deciliter, drink something with sugar like 8 ounces of Gatorade or 1/2 cup of fruit juice. After exercising, be sure to check your blood sugar again because it most likely dropped. The best time to eat is 30 minutes to 2 hours after exercising. If your sugar levels are less than 100 milligrams per deciliter, remember the 15-15 rule. Having 15 grams of carbs to raise your blood sugar and check it after 15 minutes. If it is still below 70, have another 15 grams. Repeat these steps until your blood sugar is at least 70. Once your blood sugar is back to normal, eat a meal or snack to make sure it doesn't lower again. The main takeaway here is do not avoid carbohydrates. You need them to fuel up, especially during long workouts. Make sure you get your protein in your snacks before and after to promote recovery.
As I always tell you, you have to take good care of yourself. And the way you take good care of yourself is you have to talk to the healthcare professionals, whether it's by telehealth or direct conversation. We don't want to see you just in an emergency room. We want to see you to prevent you from getting to the emergency room. Remember, this show comes to you from Nova Southeastern University. I'm Fred Lippman, and until next time, see you.